Na mtazamaji, kumbuka kwamba serikali inaendelea na ule mpango wa kuhamasisha vijana kuhusu mpango wa NYOTA ambao unawalenga sana vijana. Kila kijana ambaye amesajiliwa na kufikia vigezo ambavyo vinahitajika kuhusu mpango huo atakuwa anapokea shilingi 50,000, na kwa hivi sasa mpango huo unaendelea kutoa hamasa kwa vijana kule Mumias. Tusikilize.
On 12th of November. This observance was introduced to raise public awareness towards pneumonia, a disease that still continues to affect our most vulnerable population, who are our children below 5 years. The theme for this year's World Pneumonia Day is like the director of health from Share has already turned it into a slogan, and I think we'll remember this: that defeat pneumonia, defeat pneumonia, defeat pneumonia. Simseme kwa sauti jamani hapa. Ni kama mlishambuliwa asubuhi. Ama baridi ni mingi. Defeat pneumonia. Defeat pneumonia. So this is both a rallying cry. I don't know why they didn't say a rallying call. Because the children cry. These are both a rallying cry and a reminder of our shared responsibility. In Kenya, every breath lost to pneumonia is a call to action, because behind each statistic is a child whose life could be saved with timely care. Pneumonia is the #1 killer of children after the neonatal period, but remains prioritized in terms of visibility, financial investments, and research funding. Indeed, pneumonia kills an estimated 800,000 children under 5 each year globally, as has been given by Winnie. 1 in 5 children's deaths are caused by pneumonia. Isn't that a big number? And it's quite worrisome. Ladies and gentlemen, to reduce mortality among children who develop pneumonia, we must enhance care-seeking behavior within communities and expand access to timely, accurate, and affordable diagnosis and treatment across all levels of healthcare system. This includes strengthening the availability and use of pulse oximetry, has already been said, medical oxygen for the severe cases, medicines and medical supplies, and other essential respiratory support technologies, which remain limited in many healthcare settings. Again, this year's themes aligns well with the renewed Ministry of Health efforts and commitments to reduce childhood deaths from pneumonia, emphasizing the need to accelerate the scale-up of prevention, diagnosis, and treatment interventions. As a result, the Ministry has introduced and scaled up interventions that have a long-term impact on mitigating these causes, in line with the frameworks of pneumonia interventions of protect, prevent, and treat. Some of these interventions include, but not limited to, I think this has also been mentioned, but I'll just pass through very fast. Vaccines against pneumonia, I think we all know that. The integrated management of community case management, access to amoxicillin and dispersible tablets, and the integrated management of newborn and child illnesses. There is also continuity of care for children with pneumonia. Maybe I will emphasize on this with the new government approach to healthcare, with more emphasis on preventive as opposed to curative care. We all know that the Kenya primary care networks have been established in a number of our counties. And this is organized through a hub and spoke model, which link community units and smaller dispensary